Welcome to HealthWatch, presented by Novant Health. I'm your host, June Baker. Our show features local physicians and health professionals discussing health topics of importance to local residents. Today we will meet Mickey Winfrey of Novant Health Oceanside Family Medicine and Convenient Care, Dr. Kaylin Edwards of Novant Health Pediatrics Brunswick, and Dr. Maria Ravel of Novant Health Family and Internal Medicine, South Brunswick. Stay tuned to learn about valuable health topics with HealthWatch. First, let's welcome Mickey Winfrey of Novant Health Oceanside Family Medicine and Convenient Care. Welcome to the show, Mickey.
Thank you very much.
Now I know you're Michael,
Yes.
but you prefer Mickey. Is that correct?
Yes.
Great. Well, we're gonna call you Mickey. So we're really glad to have you here on the show, and I suspect there's lots of people out there who haven't met you yet. So
There are a few, I'm sure.
Since you haven't been here all that long, so let's start out by learning a little bit about you, your education, your training, your experiences.
Well, I've been a nurse since the mid-90s. I started as an associate's degree nurse and worked my way up through the educational channels. I, 2 years ago, finished my doctoral education at East Carolina University.
Great.
And that was quite an experience.
I bet.
Yeah, it was pretty awesome. They have such a great focus on rural community health.
Yeah, they do.
I thought that was a very valuable experience.
We have a couple of doctors at the hospital who went to East Carolina, and actually we have many, several, and they're really big on rural health and community health. So it works out for everybody. When did you join Novant Health?
Well, believe it or not, it was the day before all of this coronavirus lockdown happened. So it was the 12th of March, and the 13th was when everything kind of went to the fan, yes.
So you got here just in time for coronavirus,
Absolutely,
right?
yes.
Well, I know it's going to settle down there eventually. I understand you work at Novant Health Oceanside Family Medicine and Convenient Care.
Yes.
And that's where you have the Respiratory Assessment Center?
Yes, ma'am, we do.
And I understand that you work there in the screening process. Is that correct?
Yes, that's my predominant role currently.
Currently?
Myself and one other nurse practitioner provide that service there. We screen everybody that comes into the parking lot essentially.
Even in their cars,
Even
right?
in their car. In an effort to keep anyone that might have signs or symptoms of coronavirus outside of the office to prevent transmission to any other patients that we may have having their visits, and then we route them appropriately based on those symptoms, and then evaluate them to screen them and test them if needed.
So the RAC, or the Respiratory Assessment Center, is a little different than just going for a test.
Indeed. Indeed, there is an assessment process that happens. You will be greeted at the driveway by one of our nursing staff, and they'll ask you a series of questions, and based on your responses to those, they'll route you to see one of the providers at the Respiratory Assessment Center, or allow you to proceed into your regular scheduled appointment with your primary care provider, or if you're going into the convenient care services there as well.
Oh, good. That makes a lot of sense. Tell us a little bit about the safety measures that the staff are taking, you and the rest of the staff are taking, to ensure everyone's safety.
Well, we definitely follow the CDC and the North Carolina Health and Human Services recommendations on personal protective equipment, or PPE.
Right. We hear a lot about that now.
A lot about that. Everyone is masked at minimal level. That's even with just casual contact. Anyone that has more interaction with the patients that are at risk, we will go anywhere from mask, face mask, gloves, the full plastic garb, the full shield, and so we do everything we can to minimize risk of exposure for the staff, as well as risk of transmitting from one patient area to another.
Right. Yeah. I don't know how you keep up with all the cleaning. I mean, it's just it's a monumental task.
It is something that goes on every minute of every day.
Yeah.
Pens get cleaned, clipboards get cleaned, our equipment that we use to take vital signs is cleaned, and that's in between every patient. So yeah, it's a lot of cleaning.
It's probably the cleanest place. That's what people are saying to me. Oh, I don't want to go to the hospital. It's probably the cleanest place you can go to right now.
Could be when you need to be there, yes.
Yeah,
Absolutely.
when you need to be there, that's probably the best place for you to be. So, so when patients are experiencing symptoms of coronavirus and they come to the area for testing, then there would be separated from the wellness
Absolutely,
patients.
yeah. We do not handle any of the coronavirus testing inside the building. This is all done.
Good to know.
Currently, we are conducting this at Carside. We are in the process of setting up a program to move some of that out of the car, less Carside service, and we're setting up a building that can allow us to rotate people through and keep it more comfortably cool, because this heat out there is going to get bad before it gets better.
Yeah. Do you have any key tidbits for people out there how to stay safe? I mean, other than...
Well, the way to stay safe is what's been pounded home time and time again, and that is mask. Wear your mask when you go. And it's not for you, it's to prevent you from spreading anything that you may have to anybody else. Because the problem with this virus is that we have no way of predicting who is going to have a bad outcome from it.
Right.
So do your part, keep your mask on, wash your hands, keep your 6-foot distance. Those 3 things alone can go a long way towards reducing the transmission of this viral illness.
And that's the reason we're not masked here, because we are 6 feet
We have that
apart.
6 feet distance, 2 arms length. That's what it takes.
And we're the only 2 people in the room.
Yes.
So that makes it safe. But once we leave, we'll all be masked.
Yeah, that's what I was going to say.
Are
Carry
you
mine with me.
Well, that's really good information. Aside from the pandemic, what will your role at Novant Health Oceanside Family Medicine Convenient Care be?
Well, as soon as we get back to normal operations.
Whenever that is.
Whenever that is. I will be one of the nurse practitioners providing care at the Convenient Care Clinic. We're open from 8 to 8. We take all manner of walk-in patients. We do everything that we can for you there, and obviously if something is beyond the level of care that we can provide in a convenient care setting, then we're going to get you into the next most logical place to be taken care of, whether that's with your primary provider right away, or if you need to go to the emergency room. We will strongly encourage that.
Right. Well, great. So before we wrap up, can they schedule an appointment with you, one of our newest providers?
I do not, as a member of the convenient care team, do not accept primary care patients. So the answer to that is no. However, we do have several physicians and nurse practitioner and physician assistant providers that are accepting new patients in the office.
So the practice itself is taking new patients.
Yes.
And we can provide that number for them on the screen.
That'd be great, because I haven't been there long enough to memorize it yet.
Oh, Mickey, you're a delight. I'm so glad you came today.
No problem. Glad to be here.
I hope that after you have a few months under your belt, you'll come back and talk to things that you like to talk about.
Sure, because there are several. I really have a strong focus and strong interest in diabetes management and self-education. Yeah, I'd love to have a little conversation about that.
We can arrange that. Thanks so much for coming.
Not a problem.
Great.
Anytime.
Now, let's welcome Dr. Kaylin Edwards of Novant Health Pediatrics, Brunswick. Dr. Edwards, it is so good to see you again.
Thank you.
I know that you told us about your education and where you went to school and everything last time, but maybe somebody missed that show. So let's refresh our viewers' memories.
So I grew up in Wake Forest outside of Raleigh, and my family is from Whiteville. So we grew up a lot of our... Yes, you have to say it correctly, Whiteville. So we spent a lot of our time growing up in this part of the state. I went to my undergrad in Raleigh at Meredith College, and then I went to East Carolina for both medical school and for my residency training.
Yeah. And how did you get here?
So Novant was interested in bringing pediatrics to the area, and they called, and it felt like moving home.
And of course you knew this area and everything, so you were coming back home.
Yes.
And your grandparents still live in Whiteville,
Yes.
isn't that right?
Yes, they do.
Yeah. Well, let's talk a little bit about your office. I assume it's very kid-friendly.
Oh, of course. Bright colors, underwater creatures.
Underwater creatures?
Yes, all over the
I've
wall.
seen that office and I didn't see those. How come I missed that?
All over the walls.
All over the walls. I must not be looking around. So, well, I know with what's going on with the pandemic, it's been a real interesting time in your office as well as at the hospital. So how has your office adjusted during this pandemic?
Yes. So it's been a big adjustment really for everyone. Specific to pediatrics, it's very interesting because, you know, we see adults and children in the office because parents are bringing their kids in. So the biggest change probably that we've made is we only have one parent and one child in the office at a given time, and we screen every patient and their parent before they come into the office. We also have parents call before they ever walk in the front door.
Oh, nice.
So that we can make sure one family is not in the hallway or in the lobby at the same time as another family, just to increase some distancing.
That's some serious
Yes.
scheduling there.
Yes.
I don't know how you do that.
Yes.
Well, what about if a child is sick?
So one of the wonderful things to come out of this has been video visits.
Yeah.
And we've had quite a few of our patients take advantage of that, and it's been really neat to do them. So for sick patients right now, we see a lot of them on video visits. We also ask them all the screening questions as well. If we have any concern that they possibly could have the coronavirus, then we're sending them to be tested. Just precautionary for everyone. Thankfully, we haven't seen this huge in children in our area, but we still are very cautious about it.
Well, I was going to talk about all the measures that you're taking to keep parents calm and keep them bringing their children in when necessary, but you've kind of told me all that. So it sounds like a pretty safe office to visit.
One other thing we're doing is we're trying to keep our sick patients being seen separately.
Oh, sure.
A complete separate time of the day than our
But they are separate anyway. You have a separate waiting area for your sick patients during normal times.
Yes.
Yeah, so that's always nice. Yeah. Video visits, does the patient or does the parent act like the practitioner what do they do?
Yes.
How do you do a video visit with a child?
So video visits have really come about during all of this for us, and we've just been figuring out as we go. So we do them for sick visits, and if the child is sick, one big thing in pediatrics is you can look at a child and really rate how sick they are. And you can typically look at a child and say, well, they need to be seen by someone hands-on, or let's see what we can do by video to try to keep them home. A lot of parents really are skeptical about coming into the office.
Yeah, I'm sure.
But a lot of times our parents are practitioners. Some of our families have the Tido home care, which has been really fun.
Yeah, that's pretty neat tool.
Yes. And we're also using video visits for some well care and just health maintenance. So that's been good as well.
Yeah. Well, let's switch topics a little bit. During this time of the year, there's always these huge fireworks displays. And I want to talk a little bit about safety in terms of fireworks and water and what have you. So if we're having fireworks at home, since the displays are all canceled, what advice do you have for parents?
So this year,
just don't do it,
right? Well, and this year I'm planning for there to be more home fireworks because of all of our displays being canceled. The biggest thing is children should really never be around fireworks.
Of course.
Our teenagers are the ones I worry about most because sometimes they're just around them and our parents don't know. One big thing I tell families is always keep a bucket of water near fireworks. It sounds common sense, but there should be there. The other big thing is to never relight a firework that kind of was a dud and somebody wants to try because it was expensive. So never relight fireworks. Yes.
Yeah, well, going to water, we live around so much water here. And I don't know, when do you teach children to learn to swim? How early should you do that? And what other precautions do we need to take in terms of water safety?
So one big thing is we do know that children who are over the age of 1 who have had some sort of training around water do have a decreased risk of drowning. Unfortunately, all children less than 1, we don't really know if it helps or not. And even a bigger problem right now is there's not a lot of swim lessons being offered because of our pandemic. So the biggest thing is, I say, any child less than 5 years old should always have a parent within arm's reach. And it sounds crazy at times because, you know, we have some 5-year-olds who are pretty independent, even 3-year-olds.
Yeah.
But a parent should always be within arm's reach, or an adult. Another big thing is children watch our parents and they watch adults, and they mimic everyone. And so every person should always have a life vest on, and every person should always make sure their life vest fits. My husband gives us a hard time because even our dogs wear a life vest when we're on the water, but we have to set an example, and it's the role of us as parents and adults in our community to set that example for our children.
And this isn't related to water, but sort of. Sunscreen. Now, I hate sunscreen. I just don't like the way it feels. But I looked at my grandchildren the other day. They had so much sunscreen on, I'm afraid they're going to get a vitamin D deficiency. So what's the rule of thumb with sunscreens?
So really, we can get all the vitamin D we need in about 15 minutes in a day.
Oh, really?
We can even...
Oh, I should be real.
Yeah, it should be good.
I should be full.
Really, any child less than 6 months old should not be in the sun at all. If they have to be in the sun, you know, light layers. I even encourage our parents to have light layers on their kids. They make so much apparel now that's waterproof. I mean, or waterproof and sunproof.
Yeah, I know. Even dresses for grown-up women.
Right. So it really has made that much easier because a lot of people don't like sunscreen. The other big thing is sunscreen should be worn. The big things are your face, your ears, the tops of our feet, because it hurts to walk if they're burned. And especially on our little ones, the tops of the feet get burned and we don't realize it. Yes.
And then reapply?
You should reapply sunscreen every 2 hours. Parents often ask what SPF, and the Academy of Pediatrics says anything over 15. Which seems low.
I see these 75 and 100, and it seems like you're paying for nothing because who's going to stay out in the sun 100 times longer than...
Yes.
You know.
So the big thing with those sunscreens is they offer us to feel better, like we can go longer.
Yeah.
So it's safer to use SPF just over 15 and apply it every 2 hours. Reapplication is most important.
And especially after you've been in the water.
Of course, yes. I tell families to avoid the most harmful rays from 10 a.m. to 4 p.m. if possible.
10 to 4.
Yes.
Yeah. It's funny, being at the beach and around water, I see so many babies at the beach.
Yes.
And I always worry about their skin is so thin.
It is.
And that's really scary. But.
Yes. And we recommend for them to just be in a covered environment. So over their crib cover, over a tent, underneath an umbrella.
Right. So.
Yes.
You're taking new patients, correct?
Yes, we are.
Good.
Yes.
And you have a partner?
Yes. Dr. Lori Tackman is our other pediatrician in the office, and we're both accepting new patients.
Awesome.
Yes.
So tell our viewers how they can make those appointments.
So we encourage all of our parents to call the office. Our phone number is 721-4400, and we can get them scheduled. Often we can get them in the same day.
That would be great.
Yeah.
Yeah. And it's located?
We are right off of Highway 17, off of Medical Campus Drive in Supply. So we're about a mile from the hospital.
Right, yeah. Okay, well, it was great to have you on the show today, and I look forward to having you back soon, and hopefully the pandemic will be over.
We hope
and we won't be still wearing masks.
Yes, and staying 6 feet apart from each other.
So we're okay now because we don't have masks on, but we're 6 feet apart.
That's right.
And we work together in the same office, so we're kind of like family.
Yes.
So we're together all the time.
Yes.
And there's no one else in this room but us.
That's right.
So,
that's one thing I tell families.
Wear your masks, correct?
All children should be wearing their mask anytime they're in public, whether it's just around a few people or a lot of people, and trying to keep them away from big crowds as much as possible.
Right, so wear your masks.
That's right.
All right, thanks again, Kaylin.
Thank you.
Finally, Let's welcome Dr. Maria Ravel of Novant Health Family and Internal Medicine, South Brunswick. Welcome, Dr. Ravel.
Thank you.
I'm so happy to see you today. It's really nice to have you on the show. And I suspect there may be a few people out there who haven't met you yet. So let's introduce you by way of sharing some of your background information about your education, where you've been. I'd like to know where you grew up.
Okay. I grew up in the Philippines, and I did my medical school over there. And then after that, after graduation, I came here to the United States. I did my internal medicine residency training in New York City in Mount Sinai.
Oh.
And then after that, I moved to North Carolina.
Oh, nice. Mount Sinai's been on the TV recently with the
it's a hot
coronavirus
spot,
and stuff.
right.
That's a very popular spot.
Right,
so.
right.
I'm curious, did you always want to be an internal medicine physician, or did that come to you later?
Not really. It all started with my mother. She's the beginning of all this. She always wanted to be a doctor.
Really?
But then she was in that generation where if you're a woman, you cannot be a doctor. So she became a teacher instead. But she made a promise to herself that when it's her turn to have children, they will become doctors and have the opportunity, even if they're girls. So here we are.
That's an amazing story. I love that. I love that. And so internal medicine was always your choice, not family practice or not?
Yeah, because I'm really more keen into things. As an internist, I only see adult patients, and there is a lot of multiple medical conditions, complex, and my approach is to treat the patient as a whole, from a wide range, from wellness to complex medical conditions.
That's interesting. So you ended up in North Carolina. So how did that happen? What brought you to Brunswick County?
Okay, well after residency, we moved to an area near Charlotte, and I was there for 23 years.
Oh, wow.
I started working for the local hospital, and then we had an opportunity to do private practice for about 12 years. And then when everything was becoming, bigger, like healthcare systems, we rejoined the hospital there. And then we've visited and vacationed here in Sunset Beach.
Oh.
And we've always talked about, my husband and I always talked about maybe retiring here. But, last fall, when my daughter started college, that's the youngest one, I thought, well, why do we have to wait for retirement? So I started looking around, and here we are.
That sounds like my story. Our kids went away, they went to college, and went to college in North Carolina, and stayed.
Right.
So I looked at my husband one day and said, you know what?
Right.
Let's go.
Right, yeah.
So here we are. It's a great place to live. And when did you join Novant Health?
So actually I started in the fall, in November of last year. So this is about my 8th month.
Yeah. Well, we're certainly happy to have you. And I understand you're at the clinic, the South Brunswick Clinic.
Yes.
And let's talk a little bit about that clinic.
Okay. So the name of our clinic is Novant Health Internal and Family Practice of South Brunswick. We are located at 75 Emerson Bay Drive in Carolina Shores. It's a small town right there.
It's always hard. Some people say, I live in Carolina Shores, but they really live in Calabash.
Right.
And those who live in Calabash will say, I live in Carolina Shores. So
Right.
it's kind of confusing.
Right. Now, those are two little different towns now.
I know.
And I remember that when they had their inauguration, they had to invite the mayors of both towns.
Right.
Not hurt anybody, just playing safe, because it's for
right.
both communities
Yeah.
anyway. So our practice is a combined family practice and internal medicine. So we see a wide range of patient population ranging from infancy to adulthood.
And do you have a particular interest, a special interest in women's health or?
Not in particular, because I only see adult patients, and for some reason, they have more complex and more chronic medical conditions.
Right.
So it's really the whole thing, the whole package. It's very challenging and
I bet.
and sometimes frustrating.
It seems like the older we get, the more medicines we're on.
That's right.
The more, and we have a little bit of this, a little bit of that.
Right, exactly. It's just
I don't
part
know
of
how you do
getting older. But we see a lot of very healthy adults in our practice.
So I know this has been a very unique time for us at Novant Health and for all of our practices. It was a tough time to join us. You joined us, and then all of a sudden a pandemic happened.
Right.
So some of the patients out there I've heard have delayed care or delayed services because of that.
Right.
And what would you recommend to patients who are due for a wellness check or it's their annual physical? Should they come? Should they not come?
Right. For a lot of relatively younger and healthy patients who have delayed or postponed those annual physicals, I think, I'd say that this is the time now to start calling and scheduling those annuals again. Those who have postponed or delayed their screening, preventive testing like mammograms, pap smears, screening colonoscopies, bone densities, lab work, and immunizations. This is a good time now to start scheduling because we are getting busier again, so we want to be able to get them in. Because for those patients, you want to be able to maintain that general well-being, okay? And then, especially for the patients who might be a little bit older, those who have chronic and or complex medical conditions like diabetes, hypertension, heart disease, lung problems, those who have kind of delayed or postponed checking their lab work, if they're running out of medications, those A1Cs, the time is now. You should start returning to those clinics and not delay, because for them, you don't want to start having complications.
Correct.
Right, okay?
Yeah. That's very good information. Talk about the safety measures that you have in place in your office so that patients will feel more comfortable coming.
Right. In our clinic, and for most of Novant Health's clinics, we have a lot of safety measures in place. They seem to change from week to week depending on how the pandemic is progressing or improving. But right now, we have a staff member who is right outside the office.
I've witnessed that.
They start
myself.
early in the morning before everyone starts coming in.
Right.
They are wearing masks. And then every patient who's scheduled or who's supposed to go into the clinic are screened. There are a series of questions.
Right.
They check their temperatures.
Right.
They offer them, if they're not already wearing a mask, they offer them a mask before they go inside. And then once inside, we practice social distancing.
Right.
And then for the common areas like the waiting room and then the patient rooms, we went from cleaning it every day to cleaning it after every patient encounter, because we want it to be safe for both the patients and for the staff as well.
And you're doing virtual visits, is that correct?
Yes. Virtual visits in the form of video visits or e-visits. It became very popular during the last 2-3 months, but we are...
I think everybody wants them now.
Yes, but now, most everybody is beginning to feel safer about having this face-to-face visits again with their doctors. But for those who still feel a little bit concerned or worried about it, or they have high-risk medical conditions, we are continuing to offer that as an option.
Right.
Right.
And are you taking new patients?
Yes.
Great. Well, I know there are folks out there who are viewing this and would love to make an appointment. So tell us how we can do that.
Several ways. If they're coming as a new patient to the office, they can call the telephone number, area code 910-579-8363. For those who have that MyChart, it's a patient portal online.
Right.
They can actually go in there and start scheduling an appointment, and that will show up in our schedules. All providers in our clinic are accepting new patients.
Wonderful, wonderful. And again, the name of the clinic?
It's called Novant Health Family and Internal Medicine of South Brunswick.
South Brunswick, great. Well, it was such a pleasure to have you on today, Maria.
Thank you for
I was
having
glad
me.
we were finally able to get back on the air.
Right,
We've had
right.
to take a little hiatus,
Right.
But we're back now.
Yep.
And thank you for being one of our first guests.
Yeah.
On
Thank you
our-
again for having me. It's a
Sure.
pleasure.
Thank you. Thank you for tuning in to ATMC TV's HealthWatch. I hope this information was beneficial for you and your family. If you have any questions or topics that you would like to see discussed on a future show, please email them to atmctv@atmc.com. Visit NovantHealth.org for more information on Novant Health Brunswick Medical Center, local physicians, and general health information. Thanks again for joining us today. Be sure to join us next time for Health Watch on ATMC TV.